Hi, this is Chapter 11 still, and now this is Lecture Part 2, White Blood Cells and Platelets. So the second type of formed element in the blood are the white blood cells, also known as leukocytes. Leuko stands for white. Leukocytes perform duties in various body tissues, so they're located not only in the bloodstream, but also in the body tissues, including the thymus, the spleen, the tonsils, and the lymph nodes. The lifespan of the white blood cells are from just a few hours to a few days. So they're shorter lived than the red blood cells. Can you remember how long the red blood cells circulate in the bloodstream? Did you say about 4 weeks or 120 days? Then you were correct. White blood cells develop from stem cells in the bone marrow, just like the red blood cells do. But these cells do have a nucleus. Functions of white blood cells to defend the body against disease-causing agents by eliciting an immune response. And again, this is a picture of a centrifuge tube. This blood was collected and then spun down in a centrifuge, and it divides out in a centrifuge by the weight of the cells. So the plasma, the liquidy portion of blood, is at the top. The buffy coat, which is the white blood cells and the platelets, will form in the middle, and then the red blood cells are the heaviest and they will sink to the bottom of the tube. Leukocytes, aka white blood cells. There are 5 different types of leukocytes, and here they are. They're divided into either agranulocytes or granulocytes. Agranulocytes are cells that don't have granules in their cytoplasm, and granulocytes do have granules. The granules are actually proteins that you can see under the microscope slide. 2 types of agranulocytes are lymphocytes and monocytes. 3 types of granulocytes are eosinophils, neutrophils, and basophils. Right now, I just want you to know an example of one of the types, neutrophils, and know the job of the neutrophils. Their job is to phagocytize or eat dead cells and bacteria and foreign matter in the tissues. Let's look at an example of what this looks like. Neutrophils can actually leave the bloodstream. So they're in the bloodstream circulating. When they get a trigger that something foreign has entered the body, for example, a thorn puncturing the skin, in with that thorn comes some bacteria. So the neutrophils can leave the bloodstream. They can go to the site of the puncture and they can eat the bacteria, hopefully all of them that have invaded your body. Couple of terms to know for blood testing. Leukocytosis. Leuko is white, remember white blood cells. Cyto is cells. So leukocytosis is high white blood cell count. Leukopenia is low white blood cell count. Let's do some clinical correlations with white blood cells. There's 3 clinical correlations to know about with white blood cells: infections, leukemia, and decreased white blood cell count. So we're going to start with infections. Of course, thousands of types of infections can occur. It depends on the microbe that has invaded the body. Bacteria are one. Viruses can cause infections. Fungi can cause infections. Infections are diagnosed by, first of all, looking at the white blood cell count or looking at the blood count. And doctors will notice that there is a leukocytosis going on, a high white blood cell count, very high. So you look at the blood count, look at symptoms, and then other lab work and imaging to get a big picture of what's going on to diagnose the infection. Doctors will need to determine the specific pathogen happening here. This will be done by blood cultures. And then treatment depends on what the microorganism is that's causing the infection. So antibiotics for bacterial infections, antivirals for viral infections, antifungals for fungal infections. Another clinical correlation is leukemia for white blood cell problems. Leukemia is cancer of the white blood cells, and it causes one kind of white blood cell to multiply rapidly and take over basically the bone marrow. In that case, the number of white blood cells will increase, so this is a case of leukocytosis. The abnormal cells that are cancerous will take over the bone marrow, and it prevents the development of other types of blood cells. So your red blood cell count may go down, your platelet count may go down because the cancerous white cells have taken over the bone marrow. Symptoms of leukemia would be anemia or low red cell count, inability of the blood to clot because you've lost platelets, and the immune system won't function properly because you've lost the other types of white blood cells that you need for your immune response. Leukemia is diagnosed by a blood test, so that would be the complete blood test or CBC, and doctors will notice a high white cell count going on. Treatment of leukemia involves radiation therapy, chemotherapy, and transfusions, as well as bone marrow transplants. Third type of clinical correlation for white blood cell problems would be a decreased white blood cell number, and that's leukopenia. This happens in immunocompromised or immunodeficient patients. Causes of a low white count would be cancer. Actually, the chemotherapy that's used to treat cancer will lower white count. If the bone marrow is damaged or a disorder of the bone marrow, the patient will have a low white count. Autoimmune disorders that attack the bone marrow, such as lupus, will create a low white blood cell count. Infections like tuberculosis and HIV can cause low white count. Other immune system conditions, like Crohn's disease, and then also malnutrition can actually cause a low white count. Patient at this point is at risk for infections. So remember that white blood cells, the job of them is to act as your immune system and keep the body protected from invaders. Let's do some questions then, or review of white blood cells. All right, and we're on to the third type of formed element in the blood, which are the platelets. Platelets are also known as thrombocytes. Platelets. They're called platelets because they look like a tiny plate under the microscope. Platelets are fragments of their precursor cells, their larger precursor cells, which are called megakaryocytes. Megakaryocytes normally are only found in the bone marrow, and they are megakaryocytes because they're giant cells. You can see a picture of them here with little platelets budding off of them. If megakaryocytes are seen in a blood smear of peripheral blood, then that's a problem. That's indication of a disease like leukemia. About 2,000 platelets are formed for every one of these giant megakaryocyte cells. And we make about 400 billion platelets every day. They're continually renewed in our bloodstream. Purpose of a platelet is to prevent blood from leaking out when a vessel is injured. Their lifespan is about 5 to 10 days. And they're essential for blood clotting. And think about it, what is a bruise? A bruise is when blood leaks out of a blood vessel before the clotting process is complete. If our platelets are functioning perfectly, we will rarely have a bruise. But if the injury is hard enough, if we get bumped or punched hard enough, then the platelets can't work fast enough and a bruise will form. Now we need to talk about hemostasis. Hemostasis is blood clotting. It's the process of blood clotting. This is a series of over 30 steps that uses 13 different clotting factors. It's called a cascade. Cascade is something, think of a waterfall. It happens and then it builds upon itself over and over and over. Hemostasis happens anytime a blood vessel is damaged. It happens fast in just about 3 to 6 minutes. The clot seals the blood vessel until it can heal. So there are required elements for a clot. I want you to write a few of these in your notes. There's not a direct space for this. You want to add this under clotting process. Required elements are platelets, prothrombin and fibrinogen proteins. This is what I want you to write. So the elements that are made by the liver that are required for clotting are prothrombin and fibrinogen proteins. That means if you have a problem with your liver and you can't make these elements that you need, prothrombin and fibrinogen, then your clotting process can't happen. Other things that you have to have for clotting are calcium, vitamin K, and a lot of clotting factors. An example would be factor 8. Prothrombin activator is also a clotting factor. And again, you need to have healthy liver function because a lot of these, including prothrombin and fibrinogen proteins, are made by the liver. Let's look at the steps or the 3 key steps for clotting to occur. And this all happens the minute that the vessel is damaged. Failure in any of these steps results in a hemorrhage, which is excessive bleeding. So step 1 is vasoconstriction. This is the squeezing in or constricting of a blood vessel, a vascular spasm. And once this starts, this may last up to 30 minutes. So the vessel squeezes in because of injury to the blood vessel. So that's the first step. Second step is formation of a platelet plug. This can happen as fast as 15 seconds after the blood vessel is injured. So platelets are always circulating in your bloodstream and they're fine. Once the blood vessel is injured, there is a collagen is released from the tissue of the blood vessel. Once the platelets come in contact with collagen, they change form and they become sticky. They're called sticky then. Once they become sticky, they start to stick to each other, and this starts to seal the leak in the blood vessel. And that's a temporary seal. Step 3 then starts to happen. This is coagulation or the forming of the blood clot. This happens about 30 seconds after injury. With a normal injury to a blood vessel, the system works perfectly, and a small puncture wound the bleeding would stop in like 1 to 4 minutes. So let's look at the diagram in your notes and fill that in. A little more detail to the clotting process. So first of all, vasoconstriction is going to happen. This is when the blood vessel squeezes in and starts to constrict. Second of all, the platelet plug is going to form. And that's because the platelets start to become sticky because they're coming in contact with the collagen that's been released from the break in the blood vessel. When the platelets are activated or become sticky, they release serotonin and thromboplastin, which is released by the injured tissue, is also called prothrombin activator. This activates prothrombin into its active form of thrombin. Thrombin is needed to activate the fibrinogen, which is inactive, into its active form called fibrin. Finally, fibrin is going to combine and make a stringy polymer with red blood cells and platelets, and that equals the clot. So fibrin, red blood cells, and platelets all are interacting together to form the final clot. How do the clots get removed then? Once the tissue has started to heal, the clot will be broken down by the body by enzymes. There's a video that I put in the Schoology folder that is on hemostasis or blood clotting. It's a really good video, so take a minute to watch that when you have time. Let's go over some concepts that we just covered. Think about these 3 questions and then come back for the answers after you've checked your notes. What is the function of platelets? Function of platelets is to coagulate blood when a blood vessel is broken. So this is a normal process, goes on all the time in our bodies. We get little tiny breaks in our blood vessels all the time. Name 2 proteins made by the liver that are needed for blood clotting, and that would be prothrombin and fibrinogen. Describe the components of this blood clot. So when you're looking at this picture, what you're seeing there, the yellow would be the fibrin strands that have formed as a net, kind of, to collect a lot of red blood cells and platelets. and smash them all together, and that is basically your clot formation. Okay, as we're getting into talking about clinical correlations with platelets, let's go over some vocabulary. Thrombocytosis. Remember, means to clot. This is a condition where your platelets are too high. You have too high of a platelet level, and this causes excessive clot formation in your body. You're at risk for a thrombus. A thrombus is a blood clot that forms in an unbroken blood vessel. In other words, a clot is forming when there's really no reason for a clot to form. Thrombocytopenia, a case when platelets are too low, caused by conditions like leukemia or some medications, sometimes autoimmune disorders. In the case of thrombocytopenia, the patient is at risk for excessive bleeding because clots just don't form. Blood tests that are ordered for platelet problems, first of all, a CBC or complete blood count would be ordered, and this would give you your number of platelets. Make sure they're normal. And then bleeding time would be ordered. A bleeding time measures platelet function. And this is actually where they put a blood pressure cuff on your arm. They put a little slice or cut in your forearm, and then the technician would measure the time for the bleeding to stop. A third condition of platelets could be non-functioning platelets. The patient is at risk then for excessive bleeding. So you have enough platelets, but they don't function properly. In the case of low platelets, you might see these conditions. You might see petechiae. These are small, very tiny red dots on your body. They're red, and it's caused by capillary bleeding, so leaking of the capillaries. You might see purpura. Purpura are larger than a bruise. So bruise is in the middle. We all know what a bruise looks like. Purpura are excessive bruising. So these are larger, they're often raised, and it's resulting from bleeding within the skin. So hemophilia is a inherited disorder that is caused by a mutation in the gene that codes for clotting factors. So there's a decrease or deficiency of the production of clotting factors. Specifically, one example would be factor 8. So if you don't have these clotting factors, what will happen? The patient can no longer form clots. There's going to be excessive bleeding throughout the body, especially in the joints and in the stool. Treatment of hemophilia involves injections of the missing clotting factor. So people used to die frequently from this disease. It was known as the royal disease because it was inherited in royal families in Europe, very prevalent there, and people died very young. But nowadays, we have these injections of the clotting factors, and people live pretty normal lives. While we need clotting every day in our bodies in order not to bleed out, there are problems with excessive clotting, and anything that blocks a blood vessel that prevents blood flow is considered an excessive blood clot. This can be life-threatening, stopping blood flow reaching the organs. And then if the organs and tissues don't get the blood flow, they're missing the oxygen, which means cell respiration can no longer happen. Those cells and tissues cannot create energy to do their function, so they're going to start to die. So injury to a blood vessel or buildup of fatty plaques can cause this clotting process to start. Both of these create rough surfaces inside the blood vessel, which can activate platelets. Anytime platelets are activated, a clot can occur. Poor circulation adds to this because the blood flow is slow. It gives the platelets a longer time to become activated and start that clotting process. So a thrombus is a clot. Thrombosis is the problem with having a large clot or thrombus that can block blood flow and cause tissue death. And a very common typical example would be a coronary thrombosis, which is a heart attack. It is basically a block in the blood flow to your heart. Your heart tissue cannot get enough oxygen and starts to die. An embolism, on the other hand, is a little bit different. This is when a thrombus forms, a clot forms in a blood vessel that's unbroken, and then it breaks loose. And that clot will break loose and start floating through the bloodstream. Eventually, it's going to lodge itself or get stuck in a capillary or a vein or an artery and block blood flow to organs. And this is called an embolism. An embolism example would be a pulmonary embolism in the lungs, and it can be deadly if you don't get immediate treatment. So once the clot comes and gets stuck in that blood vessel, it's going to back up the blood behind it, and anything in front of it's not going to get the oxygen that it needs. Patients that are prone to getting blood clots will be put on blood thinners, also known as anticoagulants. And there's two main types of anticoagulants. The first is Coumadin, brand name is warfarin. This blocks the production of certain clotting factors like vitamin K. And the second type is heparin. Heparin inactivates thrombin. So they both have different mechanisms of actions in the clotting cascade, but their overall job would be to prevent clots from happening. And so they're called blood thinners. That's the common name for them. Also, over-the-counter medications would be given for this to treat a thrombus, and that would be aspirin. Aspirin actually blocks platelet activation so that the platelets don't become sticky. And if they don't become sticky, they can't start that clotting cascade. So it reduces the formation of a platelet plug. Acetaminophen, which is Tylenol, and ibuprofen, and these are all type of NSAIDs, by the way, would be given to help with the pain that might be involved with this. So why might a patient be put on Coumadin or heparin or even like a daily baby aspirin? And it would be that this patient would have a history or risk of blood clotting or a history or risk of heart attack. Let's just take one more minute to look at Coumadin and heparin differences. As I said, Coumadin stops clotting by blocking production of vitamin K. And what this does in the clotting cascade is it reduces coagulation by interrupting the clotting cascade. Heparin inactivates thrombin. Go back and look at your notes. What does thrombin do? Thrombin is essential to make that inactive form of fibrinogen be converted to fibrin. So if you don't have thrombin, that last step won't happen in the clotting cascade. So I mentioned that aspirin, Tylenol, acetaminophen, are, which is Tylenol, and ibuprofen are all part of this group of pain relievers called NSAIDs. And how do they work to prevent pain? They actually block the inflammatory process that's going on. Which of them will prevent clots, though? Aspirin is the one that can block platelet activation. It doesn't allow them to become sticky, so it reduces the formation of a platelet plug. How does rat poison work to kill rats? Rat poison contains a warfarin-like chemical that prevents clotting in rats, and so it's a really high dosage, so when the rats eat the rat poison, they essentially bleed to death. Lab tests that patients would go through if they're having clotting problems or if they are on an anticoagulant would be APTT, which is activated partial thromboplastin time, and this would be to monitor patients on heparin. And PT, which is prothrombin time, would be used to monitor patients that are on Coumadin, also known as warfarin. Let's talk for a minute about DIC, or disseminated intravascular coagulation. So this is a unique condition where your body is bleeding and clotting at the same time. And as you can imagine, this might be a critical event. When would this occur? This occurs from lots of different clinical conditions, including sepsis, which is a systemic bacterial infection or a systemic infection in your body. It's just taking over your body. It's even in your bloodstream. So sepsis or any kind of major trauma, obstetric emergencies as you're giving birth, and malignancy or tumors or cancer that can all start this DIC process happening. So it is when clotting is out of control. That's how it starts, with microclots forming in the blood vessels that lead to the organs. This blocks the blood flow to the organs, leads to organ failure. While this is happening, all these clots that are being formed are using up all the clotting factors in the platelets that are available in your bloodstream. Because of that, other parts of your body then start to bleed. So clots can't form in other parts of your body. So it's not a good situation. This can be stopped with medical intervention if this happens quickly, but overall, about half the patients that go into DIC are not going to make it. That was it for platelets. Now, just a little bit more on that fourth component of blood. The first component, remember, would be the red blood cells. Second component is the white blood cells. Third component are the platelets. Those are the formed elements of the blood. But then there's also the plasma part of the blood, which actually is 55% of the whole volume of all the blood. The function of the plasma is to transport materials throughout the body. So it's transporting materials in the blood. Most of them are dissolved in the water part of the plasma. Components of plasma know 5 components. Water, which is 95%, the majority. Dissolved proteins. 2 of the main ones are albumin and lots of different types of globulins. Glucose is carried in the bloodstream. Sugar, remember we need to regulate, needs to get to every cell in our body so that cell respiration can happen. So it's carried in the plasma part of the blood. Clotting factors are carried in the plasma, including fibrinogen, and electrolytes, sodium, calcium, magnesium, bicarb, chlorine, and others. Let's do some review questions on what we just talked about. And finally, I've been talking about this test all the way through this section, but the blood test to check the cells or to check the blood, what's going on in the blood, is called the CBC. It's called the complete blood count. The complete blood count gives you a big picture, and this is a readout of what you get from that. You get the number of white cells, platelets, and red blood cells. You'll get information on hemoglobin levels, hematocrit levels. So hemoglobin is the hemoglobin that's in your red cells. It helps to diagnose anemia. Hematocrit is the red blood cell volume that's part of the blood. And you'll get a differential, which is the 5 different types of white blood cells counted out. Also, a little picture on cell morphology. What are the cells looking like? Do they look microcytic, macrocytic? Um, are the nuclei looking normal? Things like that.